Support for Radio Friends comes from Columbia Healthy Smiles, the dental office of husband and wife team Dr. Batson and Dr. Abe, offering comprehensive and customized care to patients of all ages. Learn more by calling 573-721-9039 or online at www.columbiahealthysmiles.com. Good morning and welcome to Radio Friends on Wednesday, May the 10th. Pleasure to have you with us today. We're going to talk about something, if you're a smoker, maybe you don't want to hear this, but you should listen to it. We have Dr. Satish Kalanjeri with us and Dr. Jeremy Johnson from the Harry Truman VA Hospital. Good to have both of you here.
Thank you. Good morning.
Now, if people are smokers, they don't like to be harped upon about the importance of not smoking. But we're going to touch on this today. So I'm asking you, if your relatives or your friends have talked to you about it and you get upset, just listen to what we have to say right now, okay? Start off. What's the most important message you want to get across, Doctor?
Well, the most important message I want to get across is when you talk about quitting smoking and the ills of smoking, know that your doctor is not patronizing, and it is a conversation that we like to have to benefit our patients and our family and friends. That said, there are lots of ills of smoking, and one of the things that everybody should know is that a cigarette has lots of toxins, not just nicotine, but almost 7,000 different toxins.
7,000 different toxins?
Yeah, and several hundreds of them can be harmful. For example, it contains benzene, which is used in gasoline. It contains toluene, which is used in paint thinners, cadmium, which is used in batteries, ammonia in household cleaning agents.
Is all of that in the tobacco itself, or are those additives to the cigarette?
It's additives to the cigarettes. And the cigarette, which is a combination of tobacco and the additives, has all these toxins, and many of them can be very harmful to the body. As you can imagine, we don't go inhale paint thinners. We don't go inhale, chemical agents used in, chemical weapons.
Right.
Not intentionally. For example, hydrogen cyanide. So when we don't do it intentionally, I think having this conversation where our viewers know that cigarette contains all these toxins might get them to think, that maybe it's about time we think about stopping smoking.
What do you say about that?
Yeah, so of course we don't want to harp on people, and that's not our job to harp on people. But when we think of the ill effects of smoking, everybody probably thinks of chronic obstructive pulmonary disease or COPD. Everybody probably thinks about lung cancer. But I think the point that we want to get across is that it causes so many other smoking-related diseases. And so we think of heart attacks. Smoking is a risk factor for heart attack, a risk factor for stroke, a risk factor for peripheral arterial disease where you have blockages in other vessels besides the heart vessels. So maybe you have low blood flow to your legs and you need a procedure to increase the blood flow to your legs. We know these things. Something even alarming to me is that smoking is a risk factor for developing type 2 diabetes. So 30 to 40% increased risk of developing diabetes. So we just want to educate the veteran, other patients that are not veterans, that cigarette smoking can be extremely harmful. It can be a risk factor for, of course, we said lung cancer, but other cancers.
Also osteoporosis.
Yeah, it can cause weakness of the bone. It can be a risk factor for hip fracture as we age and continue to smoke and develop loss of bone mineral. So it has to be known that it causes so many ill effects to the body.
Does secondhand smoke have as bad an effect on people as if you're sitting there and puffing that cigarette yourself?
Yeah, so we know that secondhand smoke is just as harmful to people, or it's harmful to people. And kind of all those same things that I just mentioned that are potential diseases that we may develop over time those can happen to people that have secondhand smoke. And we know kids that are born into homes where there's cigarette smoking in the house. We know that kids are at increased risk of upper respiratory infections, middle ear infections, low birth weight, problems with development. And so we know smoking, secondhand smoke, is very harmful to folks.
How long, let's say if a child is born into a home that both the mother and father smoke, how long is that child going to feel the effects of that secondhand smoke? Will it still be with them into adulthood if they don't smoke themselves, or will it start reversing?
Yeah. So we know that exposure to cigarette smoke and to nicotine is cumulative. So there has, what's the cumulative? How much do they smoke in the home? How much is it on the clothes and on the hair that the kids inhale and breathe? But we know that over time, there are significant benefits of quitting smoking. So if the child is raised in that home and then they move out and they never smoke, that we know over time their risk for COPD, their risk for lung cancer and other cancers, we know those risks go down. Mm-hmm. And that's why it's important to get that information out. If you're a cigarette smoker, there's ways to help you quit smoking, and there's benefits of quitting smoking. If you're a child that's been raised in that environment, as you become an adult and start having decisions to make, why it's important to decide never to smoke.
Yeah, we'll talk about how to stop smoking next time you're here. But I was looking at some statistics you brought. Smoking deaths. 1 in 5 deaths in the United States are due to smoking deaths. Is that right?
That is correct. About 480 to 500,000 folks in the United States die each year because of a smoking-related death, and that amounts to about 1 in 5 deaths. In fact,
more deaths than HIV, drug use, alcohol, and motor vehicle accidents combined.
Correct. And another statistic is, if you look at premature deaths, then smoking-related death causes more premature deaths than all of the folks who have died in all the wars fought by the United States.
Vaping and e-cigarettes, is that just as dangerous?
Well, we don't know yet if it's just as dangerous because we don't have long-term data, but there are some risks, especially because vaping is available for recreational use. One of the problems is the youngsters, the middle school and high school kids are getting nicotine dependence, and this can be a problem long term.
So what is vaping anyway? Are you smoking a tobacco product, or it is strictly a chemical when you're vaping?
No, it is tobacco and chemicals. That is the problem. So tobacco is being aerosolized by this device called an e-cigarette, but then flavors and other chemicals are added to make it easily aerosolized and inhalable, and those chemicals can cause long-term problems.
Yeah, the other thing we didn't mention is increased risk of oral cancer.
Correct.
With smoking. We're out of time for today, but if you want more information, what can they do?
Well, they can call, the veterans can call the VA hospital, and everybody else can call the primary physicians who will put them in touch with the correct folks.
Okay. Thank you so much for coming by.
Thank you, Paul.
Bye-bye.